things, but I do strongly feel that all hospitals should offer discounts.
Well, that was Lisa Barnard's story. But this morning I spoke to Robert Halford about his bill.
It is one of the most unjust taxes that we impose on people who use the NHS. In essence, it's a stealth tax on motorists. No one goes to hospital out of choice. They go because they have to. It's so unjust, and it causes misery for millions of people across our country.
But we do know, don't we, that the health service is struggling financially, and it's in all our interests that it should be able to run efficiently. Isn't there some justification in using money from car owners to use the car parks?
There's two things I'd say. First of all, there is monies that can be found from the National Health Service that wouldn't impact on services. So the government themselves have published a report about procurement. They say if hospitals and the NHS use procurement better, they could save £1 billion a year. That's on buying products such as toilet rolls in hospitals and whatever it may be. Now, it costs roughly 250 million a year to get rid of hospital car parking. And the other point is, if you're a police officer or a school teacher, you usually can go to your place of work and park for nothing. And yet we make consultants, nurses, staff, cleaners, if they go to hospitals, they have to pay for hospital car parking charges. It's just incredibly immoral. It's unjust.
You mentioned private parking companies, and we indeed get quite a lot of complaints about that as well. But the British Parking Association, they say that there are operational costs to think about with these car parks, and it's a question of who should be responsible for those if parking is free. And they also say they're in favour of concessions for specific groups such as disabled people and staff on shifts. Isn't that a reasonable way of doing it rather than a kind of blanket ban on charging?
The British Parking Association would say that because obviously some of their companies make money from hospitals because of the car parking charges.
Isn't there, though, a real risk of abuse of this system? Scotland, as we've mentioned, has had this concession since 2008, but the patients' associations there have complained that car parks at many hospitals are so permanently full that people have to leave their vehicles a 15-minute walk away.
Well, that's not always the case in Scotland. I have spoken to Scottish MPs who say that isn't the case, but all you do is you develop a token system, or you drive out and there's a recognition of your number plates. If we can send man to the moon, I'm sure we can work out a system so that people don't abuse free hospital car parking.
Isn't there a bigger problem than motorists about finding ways to help people who can't afford to drive, the people who rely on public transport